WRSR, Owasso, Flint. The following program has been pre-recorded and is paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc. Welcome to Discover Flint Township, a program showcasing our local community. Flint Township is ready for your next move. And now, your host, Flint Township Economic Enhancement Director, Tracy Tucker.
I'm Tracy Tucker, and this is Discover Flint Township, brought to you by the Flint Township Economic Development Authorities, HAP, Financial Plus Credit Union, Shea Automotive Group, and 103.9 The Fox. This morning, we will be speaking with Bridget, Hollingsworth, Stafford from HAP, and we'll also shine our guaranteed rate business spotlight on Michigan Vascular Center. But let's get started with Bridget. For those of you who haven't listened to our show before, Bridget is the Director of Marketing and Community Outreach for HAP in their Mid-Michigan market. Hey, Bridget, how you doing?
Great. How you doing?
I'm good.
Good.
So I understand that today this is an all men's health awareness month,
right?
I think, right?
Yeah.
So we're going to talk about trying to get that guy of yours or for you men out there, to get in and make sure you're taking care of your health. So
Absolutely. June is Men's Health Awareness Month, and so we want to focus on that and get folks in to see their doctor and to get all the tests and all the screenings that are so important to get.
Sure. So, it's really... guys are really not the best about going to the doctor.
No, they're not. Historically, you'll hear guys say, and it's really true, that men seem to be more hesitant to go to see the doctor when something is wrong or they think something is wrong. And they're also not as likely as women to get those preventive screenings and get their checkups. And that's kind of scary because, we've talked about this before, but early detection of medical issues is really the best way to improve their condition and to make sure that the treatment and management of that issue is handled as best as possible. And it really is an important topic, and that's why the month of June is dedicated to men's health awareness.
All right. So make sure you're listening in for the next few minutes. If you don't plan on staying for the whole show, at least get the next few minutes because
for sure.
This is very important. You're going to kind of go over with us what screenings that men should be sure to get at certain age groups, right?
Right. So to start out with, if you're in your 20s or 30s, this is really a time when you need to start thinking about having an ongoing relationship with a primary care physician, and that's family practice, internal medicine, someone who can handle your overall health. They'll be able to send you to specialists if need be and so forth, but really having a trusted health professional who knows you, knows your history, knows what's going on with you, and can talk to you about health concerns really makes it easier to stay on top of all that stuff that you need to do. So at this stage in your life, the 20s and 30s, you really need to start looking at biometric screenings and early detection of certain things. And so some important aspects of that, vaccinations, that's been a huge topic of conversation. An annual flu shot, super important. A tetanus booster you need every 10 years. And I'm going to say it again, if you haven't gotten your COVID-19 vaccine yet, now would be a great time to do that.
Yeah, and tetanus, that's very important, especially like if you're in the construction field or something like that. I have had friends who have passed away from being injured and they didn't have their tetanus shots and stuff, and they were in the construction industry. So make sure you're getting that.
Yeah, it's very important. A few other things you want to start looking at in your 20s, your blood pressure, your cholesterol level, and also diabetes screening. Diabetes is so prevalent in our community, and it's something where lifestyle factors and family history can increase your risk. So you definitely want to start checking that out around that age. You also want to start doing an annual skin check. Have your doctor look at your skin yourself for moles or any changes, some things that might dictate skin cancer or other types of conditions that need to be managed. And it's also time to start looking at depression screening. Depression is a huge issue and a problem. So those are the types of things that your doctor's going to recommend when you're in your 20s and 30s. And it really sets the foundation for the future cancer and the things that you need to be thinking about to stay as healthy as you possibly can.
Right. And one of the biggest things is just make sure you have a doctor that you trust and that you start seeing them at least once a year.
Exactly.
Right?
It's really important to have that relationship. Again, having somebody who's sort of the hub of the wheel, if you will, that kind of helps coordinate everything that you're doing and knows about all the different conditions you have and is able to kind of help direct you to the services that are going to be most beneficial for you. And once you get up a little bit into, the 40s and 50s, of course, the things we talked about before are still important. But this is when you start to see the increase in risk factors for things like heart disease and diabetes. And some men also may notice that their blood pressure is getting a little bit higher around this age, and they're seeing weight gain because their metabolism is slowing down a little bit. So a few of the things that should happen in the 40s and 50s, it's no fun, but it's really important. Colon cancer screenings.
Yeah.
So, whether some of those can be simple tests, others can be a colonoscopy. You'll, again, get some guidance from your doctor, but you need to have those every 10 years, starting around age 45. You also want to talk to your doctor about having a prostate cancer test. It's really important, and your doctor can help you determine if a PSA test is good for you to have. And another thing you want to start looking at more closely in the 40s and 50s is your eye exams. You want to get screened for glaucoma at least every 1 to 3 years. So at this stage, it's also really important to focus on heart health, and that means paying more attention to your diet, being more active, and trying to maintain a healthy weight. So those are some focus for your 40s and 50s.
Yeah, and you're not saying you have to get a colon screening every year. I mean,
No.
it's every
Right.
every 10 years. So get it done, get it out of the way,
Exactly.
and set your calendar for 10 years down the road.
Yep, and your doctor can help remind you. I've experienced that myself. So, and then, as you get up into your 60s and so, really, this is when we need to continue looking at those physical things, but staying mentally active is super important for your overall health and well-being. So men's screening at around 60 and up should include all of the things we've talked about before, but you also want to start looking at a few other things. You want to talk to your doctor about some of these things and get their guidance on how often they should be screened, but some things you want to look at, make sure you're adding a pneumonia shot in your 60s, and pay a little bit more attention to your brain health. Your doctor may do some memory tests or other kind of tests to help, measure and keep track of your brain health. Mental health screenings are still really important, and this age is around when we start to see some hearing deterioration as well. So that would be something your doctor might add to your overall screenings when you're around 60 or so.
Yeah. And we're going to talk a little bit more about this, but before we do, I will remind everybody, I am not a doctor.
Neither am I.
We do have a doctor on later in the show,
Yes.
but I am not. So if you have a question on any of these things, please go to your physician. So, but we will talk about this a little bit more. So, brain health and memory test, mental health screenings, hearing tests.
Yeah.
So those are a little bit different. They may have to do with colon exam and those types of screenings as well. Basically, getting into your doctor is the first step.
Oh my gosh, that's so important, Tracy.
Quit worrying about what it is you need to go to him for, because if you should do an annual exam, right?
Correct.
Every year.
For sure. Everyone needs to see their doctor at least once a year.
Yeah.
And don't brag about how long it's been since you've seen your doctor. That's horrible. I hate to hear that. But some things you really want to do, make sure you're scheduling these recommended screenings, by or around the ages that we've talked about. It really can help identify health issues before symptoms appear, and it could help detect conditions really in the early stages when it's much easier to treat. It's much less invasive. It's much less inconvenience for you, too.
Right. And if you have an issue, you need to tell the doctor what it is.
They've heard it
not
all.
a mind reader.
I talk to a lot of doctors. They've heard everything. So don't be afraid to talk to your doctor.
But I love they should know what's wrong. Well, my husband had.
They're not
talking.
magicians.
My husband said, if they wanted a patient who wasn't able to communicate with them what their symptoms were and what was wrong, they'd be a veterinarian.
Exactly. Although they say the animals are, you can translate them too. I have an app that translates what my cats say.
Oh, that's funny.
Yeah. I don't know if it's true or not.
But yeah, definitely tell your doctor if there's anything weird going on in your health or anything like that.
You're going to want to talk about your lifestyle, your diet, and be honest. Like I said, they've heard it all. They're not going to judge.
No,
you want to talk about your family history, any of the health-related topics that are going on with you or your family. And you do, like I say, make it a priority. A lot of people do, we've talked about before, New Year's resolutions. Even if one of the things you do at the beginning of the year is say, okay, when is my checkup or my wellness exam or my whatever you want to call it? Let me make sure I have that scheduled. Make that something that you do every year without fail. It's so important.
Yeah, and a lot of the insurance companies pay for that.
Oh my gosh,
right?
Preventive care is covered, and that was under the Health Care Reform Act, and Obamacare kind of helped to make that where you should not have to pay anything for services that your provider bills as a preventive service.
Sure.
Certain ones might require that it's done within certain periods of time, but ultimately you should not have any cost associated with your preventive care.
No excuses.
Exactly. So reconsider the reasons why you haven't been to your doctor. Please take a second, think about yourself and your family, and really talk to your team about some potentially life-saving screenings. I mean, some of these things are really simple to do, but they're so important to do. And again, I'm going to say it one more time, probably more than one. Get your COVID-19 vaccination if you haven't already. There are lots of opportunities around Genesee County and the area to do that. Please get your COVID-19 vaccination.
Yeah, we talked to Pastor Prince from Central Church of the Nazarene, which is in Flint Township, but they're still doing the vaccinations there every Wednesday if anybody wants to come. I think they're doing walk-ups as well now.
Yep.
I mean, but go to the Genesee County Health Department website and you can
GC
schedule.
for me.
GC for me.
GC for me.
Yep.
And because men's health is so important, we're doing some events this month. Some of them are targeted to our Medicaid members, but really the information we're going to be sharing is appropriate for everybody. So you could visit our website at hap.org to get more information. But we have some events coming up on June 17th and June 19th, and we've got a whole host of experts to help answer questions and provide information. We're doing some in-person activities around Detroit, and we're doing so folks up here could access us via Zoom or WebEx. And so visit our website, hap.org, get more info, get in and get your care, men.
Yeah, there you go. So, wow. This has been an exciting show. We talked about so many things. I'm trying to think what else was there I wanted to bring up. I mean, the men's health is so important, and I am
maybe we need to tell the women
about going. We need to do the women's one too because I know I'm bad, but my husband's worse. So we had to do the men's health one now. Yeah. So Men's Health Awareness Month. Make sure you talk to your guy and get him to do this. Or if you are a guy and you're listening, you need to get in and talk to your health provider.
Please
it's
don't
very
put
important.
it off. Please see your doctor.
Yeah, we'd like to keep our listeners healthy.
Right. We need all of you.
Yeah, we need all of you. So I guess that's it for this month, huh?
Thanks, Trace.
It's so nice having you here.
Thank you very much.
I'm trying to think if we have anything coming up, but Bridget will be back again next month, and she is from HAP Empowered.
Right. HAP Empowered is our Medicaid brand, and we're thrilled to have so many members here in the greater Flint area, and we're happy to serve all of our members. So again, hap.org is an awesome place to start for all kinds of information, and HAP is here for you. So.
All right. Awesome. Well, thanks for coming in. And coming up next, we are going to have our Guaranteed Rate Business Spotlight with Michigan Vascular Center. So we'll see you again next month.
All right. Thanks, Tracy.
Right, bye. We want to do a special thanks to all our sponsors: Flint Township Economic Development Authorities, HAP, Financial Plus Credit Union, Shea Automotive Group, and 103.9 The Fox. During our Guaranteed Rate Business Spotlight segment, every week we feature a local Flint Township business, and today we have Dr. Mark Mattos from Michigan Vascular Center. Welcome today. How are you?
I'm doing well. Thank you, Tracy, for having us.
I really love your property that's there at the corner of Linden and Bristol, right? It's beautiful. You guys always take such immaculate care of it. And I kind of went off topic because I didn't even talk about this earlier, but I do want to say that's where it's at, the northwest corner of Linden and Bristol Road. You all see it there when you're stopped at that light that takes forever, but they can stop in and see you guys. But let's start out with who you are and what you do at Michigan Vascular Center.
Well, thank you. I'm a vascular surgeon, and I'm the program director for Michigan Vascular Center Vascular Surgery Fellowship Training Program.
Okay.
And I'm one of 10 vascular surgeons who are in the group.
Wow.
And 7 advanced practitioners who take care of patients with vascular disease.
Okay. So when you're talking about vascular disease, and I didn't say I was going to ask you this either, but what exactly do you mean by that? That's when you get into the veins and stuff, right? Or
no,
what exactly is that?
It's part of the answer. So
Okay.
what we do is that, and that's a common misconception amongst the public and the lay people who aren't in medicine, is that we treat both veins and arteries. And so I like to think of it as, and we like to think of it as, that we treat everything from the head down to the toes, but not inside the head and not the heart.
Okay.
Everything else is our domain in terms of what we care for with patients with disease. So
Wow.
carotid arteries to prevent stroke, the aorta to prevent aneurysms. And so we take care of everything except for two places on the body. That's inside the head and the heart.
All right. Awesome. And I'll remind everybody, I'm not a doctor. So we say that quite often on here. And I didn't stay at a Holiday Inn. So I'm going to ask the same questions that everybody else would ask. But before I want to talk more about your team later. But before we do that, how long have you been in that location there at Linden and Bristol? Do you know?
Probably a good 25 to 30 years.
That's what I'm thinking.
They were just down the street at a smaller place for the first 5 to 10 years, 15 years. And then as they grew, I've only been here 6 years, but as they grew from a small company to a larger company, they needed a bigger space.
Sure. So you've already talked about what services you... Now, do you provide services at the hospitals and outpatient facilities? You do both?
Yeah, we're large enough to do that, and we've had a pretty good growth, which we're very grateful for.
Sure.
We work at 4 hospitals in the region. We work at McLaren, Genesis, and Hurley, and at Lapeer Hospital, and we do emergency services at McLaren, at Hurley, and at Genesis, but not yet at Lapeer.
Wow.
We also have 5 different outpatient centers that we take care of patients, both seeing them in the clinic and also performing procedures. And so we have a pretty wide-ranging area. We go up to Saginaw. We have outpatient centers here in the Flint area. And we have a vein solutions with Dr. Scott Garner, who's one of my colleagues and partners. He does only veins. And so that's his specialty. So we have a pretty wide-ranging, comprehensive area that we treat.
That's awesome. So now you talk about that you do have a single center comprehensive care concept. What is that concept and how does it work?
Well, much in medicine can be fragmented. And so I don't know what your experience is, but I've been a patient before. And so I've been asked to go one place, then I have to go to a next place,
Right.
and then I have to go to a next place, and I have to do this and I have to do that.
Sure.
From a vascular surgical point of view, since we take care of patients everywhere in the body except the head and inside the heart, our patients want to know that we can actually take care of them in a one-stop visit.
Right.
And so we do that. And so that involves the initial care by nurses and the surgeons and the advanced care providers. But that also includes the non-invasive vascular lab where we actually look at arteries and veins under an ultrasound. It involves, if like some of our patients, we're not able to save their legs. It's just part and parcel of the work we do.
Right.
And so they have an amputation. So rather than sending them somewhere else to be evaluated by a physical therapist, a prosthetist, or an occupational therapist for somebody who's had let's say a below-the-knee amputation, we have that service in our office. It's an in-house office, and it's called Amputee Associates, and they are within the Michigan Vascular Center realm. And our patients are so grateful because they would move from the room that I see them in 25 feet away, and there's a prosthetist who will then discuss all things about having a prosthetic leg and the newest advances, and our patients don't have to travel.
That's awesome.
They go to the parking lot, they come in, and they see everybody. We think that, from a cost efficiency, from a clinical efficacy point of view, is the only way to go, and we think that distinguishes us from a lot of other people. We're the only, only vascular center in the Midwest 13-state region that has that ability to do that.
That's awesome. And just the stress that it takes off the patient, too, would help recovery, right?
Yep. So what happens is that when, in that circumstance, and we'll just focus on that, most patients, by the time they come to that point of view, are saddened by the fact that they've had to lose their leg because of diabetes, because of ulcer, because of smoking, all those risk factors that lead to things that we weren't able to save the leg, which happens in a small number of patients. So part of the comprehensive care, having the prosthetist and the team approach to vascular surgery is that we also assess their wellness and their mental needs as well. They need that kind of support for us to say, it's going to be okay. Right. You're going to be walking. It'll be with a prosthetic leg. But you're going to be walking and living your life normally rather than being depressed and saddened at home not doing things.
Yeah. You help them through the trauma of the situation.
Absolutely. Yeah.
That's wonderful. I thought of a question while you were talking and it just went out of my head. But that's okay. I'll think of it like 2 minutes down the road. So you have a team there that are not only locally well-known, but nationally as well, that are held up as leaders in their field. You want to talk a little bit more about that?
Yeah, I'd be happy to. So one of my partners, Dr. Robert Molnar, who's been here since 1998 at Michigan Vascular Center, he is the SVS chairman for the Outpatient Labs Committee for the SVS. And that has to do with establishing accreditation nationally around the country for outpatient-based labs, which is a new way to treat patients out of the hospital. It's a more cost-effective, more clinically efficient way to get patients in and out, particularly in today's world of COVID. Right. You don't always want to be in the hospital. And so what we can do is bring them in and out. And Rob actually was the first person to establish an OBL with Michigan Vascular in 2005.
Wow.
So he's been the leader nationally, and now he's the chair. Myself, and I've been able to be selected for several national I was a recent president of the Midwestern Vascular Surgical Society, which is the regional society over 13 states in the Midwest. That was in 2018. And I serve as the co-chair for the SVS Political Action Committee, which basically talks to politicians around the country about medical issues, about reimbursement, about patient care, about what they call surprise billing and access to care. Yeah. Because many times our seniors, we have to go through this thing that's called prior authorization, which means we have to get the okay from people 1,000 miles away to treat your mom or my mom or somebody else's. So we help with the legislative issues that way, and I'm the co-chair for that. The third person...
That's very important to get through that red tape and figure out...
And we can't do it as physicians. It has to have political muscle. And so we talk on Zoom meetings with all the politicians around the country who are supporting that. And then Joe Jackett, who is our CEO, he has been on the initial steering committee for the SVS Physician's Assistant group that's part of the SVS, him and 6 other members. So we have a lot of local and we have a lot of national recognition for which we're proud of. Yeah. And we have other people who are doing different things in the state and in the region as well. But nationally, we're the main 3.
That's wonderful. And I remembered my question while you were talking, so I wrote it down. So how does somebody use your services? Do they have to have a doctor referral, or does it depend on what their insurance is and that type of thing? A
lot of times we take everybody that comes our way, right? And so A lot of times, though, the insurance will specifically say you cannot come see any of the physicians at Michigan Vascular unless you get a referral from a primary care physician.
Okay.
So many times, though, people without insurance will come to the emergency room, and then we will see them. We don't need a referral. We know that they have a problem.
Right.
We know that we have the expertise to be able to address it. So we go see them. We don't care. But I think for the most part, most of our patients come with referrals from primary care or internal medicine or cardiologist as a way to get them into our office.
That's great.
Yeah.
And now I would think that in the medical field, research is obviously important, very important to improve your patient outcomes. Do you participate in clinical trials and the like?
Yes, we do. I mean, again, Dr. Molnar has been leading that, and we're all involved in the group, all 10 of us as vascular surgeons and the 7 advanced care providers. Since 1998, we've been involved in 85 different clinical trials.
Wow.
And when you look at it, it comes out to about 3 or 4 per year. We have our own research center within Michigan Vascular Center where we basically, that's all we do is that they adjudicate the trials and do all the patient care follow-up and all the administrative task work, which is really, really quite a lot these days. We believe that if the only way we really can advance patient care is through research, because there are a lot of grafts, a lot of stents, a lot of new treatment techniques that we are a part of that now are mainstream, that weren't mainstream in 2000 or 2005. One of the examples that we do is a new treatment for carotid artery disease to prevent stroke, and it's called a transcarotid arterial revascularization, or TCAR. And it's where we do a minimally invasive approach through a small incision in the neck, and we place a bare metal stent to trap any blockages or anything that might throw clots to the brain for a stroke. That's a new research trial, and we're part of 2 trials regarding that.
Wow.
That wasn't present 10 years ago.
That's amazing.
Yeah.
That's just amazing. And I know training and education are extremely important as well.
Yeah.
And you're doing some things with that with fellowships?
Yeah, I'm the program director. Dr. Chris Goltz and Dr. Ranjit Dotla are our associate program directors. And our philosophy is that you don't advance community health care as well if you unless you have training the next generation of vascular surgeons. Mm-hmm. So what we do is that we train 3 vascular surgery fellows who've completed general surgery training but now want 2 additional years of vascular surgery, and so that they can become like me, like Dr. Molnar, like Dr. Goltz, so that in 2 years they're able to practice on their own. I've been multiple places. I've been Southern Illinois University, the University of Washington. I've been at Wayne State University, and every place that I've been, the thought has been is that education and training advances the care of patients within that region. It's just, it changes the concept of how you take care of patients and the care that they receive.
Awesome. That's awesome. Now, how would people get a hold of Michigan Vascular Center? I'm assuming they can go online.
Yes.
And what's that website?
It's www.michiganvascular.com.
Okay.
Easy to get, easy to remember. And then the phone number is 810-732-1620.
Awesome. And I think I appreciate you coming in today. That's fascinating to me. I really enjoy learning about things like this. And maybe I can get with Joseph and we can have some of the other companies that are under your umbrella come in and talk as well, like Vein Solutions, and then the gentleman who does the prosthetics.
Yeah, the Amputee Associates.
Yeah,
that'd be great.
Amputee Associates. Love to have them. But for right now, I'm going to thank you for coming in. It was wonderful to meet you and to also get all this awesome information. I would like to remind our listeners that if you have any questions, you can contact us at discoverflinttownship@gmail.com or visit us on Facebook at Flint Township Events, FLINTTWPEVENTS. You can go to our YouTube channel, Discover Flint Township, or visit our web pages, discoverflinttownship.com or flinttownship.org. I want to thank our guests today, Bridget from HAP and Dr. Mattos from Michigan Vascular Center. And thanks to our partners, HAP, Shea Automotive Group, Financial Plus Credit Union, Guaranteed Rate, and 103.9 The Fox. Discover Flint Township with us next Sunday at 7:30 a.m. This is Tracy Tucker, the Flint Township Economic Enhancement Director, and I would like to remind everyone, stay safe, safe, stay healthy, shop local, buy local, and discover Flint Township. See you later.
This has been Discover Flint Township with Tracy Tucker. For more information, visit discoverflinttownship.com. Flint Township is ready for your next move. The preceding program was pre-recorded and was paid for by Discover Flint Township. The views expressed are those of Discover Flint Township and do not necessarily reflect the views of 103.9 The Fox or Krill Communications, Inc.